first aid. We are learning very, very strange things that you people need to know and understand. Because I'm sure at one particular point you are stranded on what to do. But now the big question is, in case of an event where an accident occurs, does the casualty need to give permission to receive first aid? That is what we are going to hear from our guest, Anna. Welcome, Anne.
Thank you once again. So, yeah, it's a very good question. And there's something called consent. What is consent? Consent is whereby I need to ask for your permission before I touch you.
Before you attend to me.
Even touching you, like
yes.
consent, like. So, yeah, I found you are stranded, you cannot talk, and you need help. It is advisable for me to seek consent, ask whether I can help. I know you're wondering, motive, like I cannot talk or I'm blind, you can't see me. So today we are in the age of technology. You can record yourself, like video record. And then you introduce yourself. My name is Anna, I'm a first aider. May I help you? Why am I saying it is important? You've heard of cases whereby someone said, I was raped. Someone stole from me. So you are out there trying to help someone, yet that someone has ill intentions. So it is always good to seek consent. And nowadays where there is a lot of accident, you always find a crowd. At least you'll get some nice witnesses.
Yes.
So it is important to avoid being taken to court because you don't know the person whom you are administering first aid to. But if it is a workplace case, they know that you are their first aider, you can proceed and do your job. Yeah, the law requires you to do that. But for a stranger, always ask their permission. That is what we call seeking consent.
So it is important to seek consent. I understand that. Irene, are there some steps that we need to follow to administer first aid care?
Yes, Lucy, there are steps, but before I start with the steps, just a small addition.
Yes.
When we've been talking about a casualty, who is a casualty in this case?
Yes.
We know it's someone who has experienced that injury, illness, or an incident.
Yes.
But when it comes to casualties, we define them in two ways. The first one is an expressed casualty. This is someone who is conscious. You can ask them questions and they can answer back. You can seek consent and they can either agree or disagree. But another type of casualty we have is called an impaired casualty. Now in this particular case, this is someone who has lost their conscious state. They are unconscious. So when you ask this person, can I help you? They won't be able to answer back. But in a case like this, you have to be humanitarian. So that drive will give you the energy to perform or manage this particular situation.
Yes.
So in a case where maybe after the management, a few months later, they start claiming that maybe you stole from them or you touched them in unnecessary ways, then we have a law that is called the Good Samaritan Law. That
it's in this country?
Yes.
Kenya?
Okay. That as a good Samaritan, I found this person in a bad state and I decided to help.
Yes.
And then in addition to whatever Anne has told us, use the technology, you can take a video, you can record yourself. And then lastly in Kenya, eyewitnesses, very prominent.
Yes. Videos all over.
Yeah, you will not lack the eyewitnesses. Yes. So when it comes to steps in performing first aid management, we have something we call a primary survey.
Yes.
So in a primary survey, these are the initial steps that you take, which is systematic, in order to identify the life-threatening conditions that a casualty might be undergoing. For example, if I'm a casualty and I'm not breathing, then that is a life-threatening condition.
Yeah.
So when it comes to primary survey, we normally use a very simple acronym that is called Dr. ABC. So D, Doctor, A, B, C.
Ni doctor of D-O or D-R?
It is D-R. Okay. D-R, C, Doctor.
D-R-A-B-C.
D.
D.
D stands for danger. For me to collapse, for me to cut myself, for me to do anything to affect my health,
Yes.
I've been presented with a particular danger. It might be fire, poisonous fumes, oil. So you have to assess the situation.
Yes.
If I give a very good example, I have found Motua in an unconscious state of mind.
Yes.
The first thing I've entered in that room, I will assess the situation and know what has happened.
Yeah.
Why is Motua not responding to me? What will happen? If I don't react quickly, then Motua's health is deteriorating.
Yes.
What might happen? If I don't call for help, Motua might lose their own life. So I have assessed the situation.
Yeah.
In assessing the situation, I will know very quickly what has led to this condition. Was it a leaking gas or a leaking chemical?
Yeah.
Then from there now, after I assess the situation and know where the danger is coming from, I will make the area safe. Here now we basically consist and emphasize on your safety comes first.
Yes.
Do not hurry up to go perform first aid to a person and you are not safe. Your safety comes before everything and anyone else.
Yes.
So you will make the area safe for you, the casualty, and if you have any bystanders around, you also take care of them.
Yes.
So in a case like for this one, Motua, if it is a leaking chemical, then I will have to take Motua outside
Yeah.
and perform the management outside, where there is no danger of that particular harmful chemical. So once you make the area safe, now you start performing the emergency aid. And we also recommend that as you perform the emergency aid, you can be making a call. Technology has helped us. You can put your phone on speaker mode, yes, and call for help. So what are these things that we look at when you're performing this emergency aid? The first thing is response. And in response, we want to know and understand, is this casualty conscious or unconscious? So when you want to check if this casualty is conscious or unconscious, I'll touch the casualty, the first thing. If the casualty is okay, then they are alert. But you might find maybe the condition was so severe that unnecessary movements, they are so not possible.
Yes.
So you come and try to talk to them. If they don't respond, you inflict pain.
Yes.
On the casualty's body. And you can inflict pain either behind the earlobe. You remember back in school, our teachers used to walk with a biro, and when you make a mistake, they just press the biro against your earlobe, and it was very painful. So you can inflict pain at the back of the earlobe or at the collarbone, considering that there are communities which cut off completely their earlobes.
Wow.
Or someone maybe had a minor operation
or a deformity,
yes, and they don't have an earlobe. So you can choose the collarbone. So if this casualty does not respond, then we now determine that the casualty is unconscious. So now we come and make sure that we open the airway. The airway where once I breathe in, the air passes through to the lungs. So every time you meet a casualty, always assume that the airway is blocked.
So now we were in Dr. ABC with danger, response, and now we are in the airway.
Yes.
Yes.
So when you're opening an airway, we have two methods.
Yes.
The common one is called the head tilt chin lift, which you are going to demonstrate. And the other one is called the jaw thrust maneuver. So the difference between these two is the jaw thrust maneuver, you only perform it to a casualty who you suspect they might have a spinal injury.
Yeah.
And examples of these casualties is someone who has maybe fallen from a height, someone who's been engaged in a motor accident, either a matatu, vehicle, or piki-piki. Then someone who has fallen in an awkward position. Anyone who has an injury on the head, face, or neck. Also always assume they might have a spinal injury. And then lastly, anyone you know that might have had a spinal injury, a history of spinal injury or disorder.
Okay.
So you cannot open their airway through the open tilt chin lift. You'll be tampering with their spinal cord.
Yeah.
You have had most often people who get engaged in a road accident. They do not become disabled because of the accident,
Yes.
but because of how they were handled and transported from the scene of the accident
Yeah.
to the hospital.
Mm.
Yes. So after you open the airway now, you come and check for breathing. You want to see if this person is breathing. So when you check for breathing, we say you look for the rising and falling of the chest.
Yes.
When you're sleeping and you're breathing in and out, your chest moves up and down.
And down.
Then you can feel for the warmth air coming out from the nose or mouth, and you can listen to the noisy breathing.
Yes.
When someone is having difficulty in breathing, they tend to breathe with the noisy sounds. So you can try to listen if you're going to hear.
Yeah.
So after you check for breathing, and let's say we found that this casualty was unconscious, but now they are breathing. Then we use, after the management of everything, you put this casualty into a recovery position, which we are going to see. So after you check for breathing, now you come and check for circulation. So in circulation, you are basically trying to look for the palpitation, the pulse.
Yes.
So when you're checking for circulation, we say you use these 2 fingers directly below the jaw. You're going to listen to the palpitation movements. But for someone whose condition is worsening, then their palpitations will not be as normal as for me who's not injured or ill. So when you're checking for palpitation, we say that you have to check for the strength, the rhythm, and the rate of the pulse. A healthy person has a normal beats per minute of 72.
72.
So for someone whose condition is deteriorating, the rate reduces. Or someone like who has high blood pressure, their rate is very high.
Very high.
Yeah. So you have to check for the rhythm, the rate, and the strength of the pulse. So after that, if at all this person was unconscious, and now I checked for breathing, they are not breathing, then I will be ready to start something we call CPR, cardiopulmonary resuscitation. So CPR, basically, we are trying to make the heart work in a manual way. Right now, it's automatic.
You're waking it up.
Yes, we are working it up.
You have to live.
Yes, you have to live. So we are trying to pump in and out the blood, but in a manual way. So you have to locate the position of the heart. Lucy, I know very many people think that the heart is at the left.
Yes. that is the common norm. In the community, we know that the left side is the heart.
Yes, but when it comes to the movies that we watch, when they are performing the resuscitation, they don't come to perform it on the left side.
Yeah, they don't.
It's at the center. But a part of it is inclined on the left
On
side.
the more than the right.
Yes, because it's the bigger part of the heart and it has to pump blood to the whole body. So you'll have to locate the position of the heart. So we normally say you can draw something like an inverted triangle or the last rib bone. You can draw a straight line where your fingers meet. That is where the heart is. So CPR, we perform it in a ratio of 30:2. 30
Mathematics now.
mathematics.
Yes.
30 chest compressions and 2 breaths. The one that they used to call the kiss of
life.
kiss of life. Yeah. So the only time you can stop performing CPR is if the casualty regains their consciousness. Also, if the help that you had called for arrives, or you are exhausted, because you can perform the CPR and it's not quite an easy job until you get to a point where now no.
So what?
So for now, you have to just determine.
But you can't just rest at this particular point in time.
You can't rest at this particular point
Yes.
in time, but still you can't perform CPR on a casualty more than 3 hours.
Mm-hmm.
You'll be exhausted.
Mm.
But if you have someone you can interchange with, you can agree. Let me do 2, you do 2. Or I do 5, you do 5. That one would be much better.
Yes.
Yes. But for us, if you're not a doctor, you can't proclaim that someone is dead.
We were in circulation. So D.
So D now stands for the defibrillation, which is the CPR.
Oh, sorry.
Yes.
Yeah.
We have-
CPR now is D.
Yes.
Okay.
We have a machine that is called a defibrillating machine. The one that you find, it's like they are placing an iron box on someone else's chest to administer the shock on the casualty. So there are people who might have the chance to have the defibrillating machine present, but if not, you just perform the CPR in a manual way.
At some point, the patient has not woken up. So what next, Irene? Anna,
Remember,
after all this time,
yeah, so
Irene has tried and tried and tried. She's tired. Maybe the other person is tired. No more machines, no defibrillator. Now, no change.
So remember, when she came and found that someone was on the floor, she found an accident, the first thing she said, you call for help. So maybe she was on the Thika Road, she already called the nearest police and the hospitals. So by the time she finishes, we assume the ambulance will be there. You understand? So that is the point of you call for help first as you continue to preserve life over here. So never like assume you're going to make it on your own. Always call for help and then try to administer first aid. You're not a doctor, always remember that. You are a first aider. The duty of a first aider is to preserve life and to save it. You understand? So there's no point where you are going to administer first aid and not like get help. The goal here is to get help by saving life. Yeah.
Thank you so much for that. We are doing well because that was basically good to understand that it is a process. First aid is not just a one-stop, one thing, at one particular point and you're done with it. This is TBS TV Africa. We shall continue after the break.